like to talk about the anxiety spectrum disorders. Disorders that include generalized anxiety disorder, panic disorder, social anxiety disorder or social phobia, and OCD, obsessive-compulsive disorder. There are a few others that are more esoteric, agoraphobia, other specific phobias. Panic disorder is really on a spectrum with generalized anxiety disorder. So all patients who are prone to having panic attacks, particularly spontaneous, unprovoked panic attacks, also suffer from generalized anxiety, but not all patients with generalized anxiety experience panic attacks or necessarily meet the criteria for panic disorder. They may have had a panic attack or two in their life when they were very stressed, very overwhelmed in certain circumstances, but they don't spontaneously have them, or they don't have them frequently enough to make that diagnosis. But I think that's the same condition, just a varying degree, a varying severity. The other conditions are distinct. Social anxiety is distinct, but it's also related to inadequate serotonergic neurotransmission. Common enough, but not all patients with generalized anxiety or panic disorder have that. In fact, most don't seem to have. And again, this is anecdotal. The prevalence in my experience in the patients that I've seen, most people with GAD and or panic do not also have social anxiety, but some do, and then some also have, almost all patients have OCD tendencies, because again, that's related to inadequate serotonergic neurotransmission, but the full-blown disorder of obsessive-compulsive disorder, whether it's mild, moderate, or severe, is probably the rarest of the three, and if we're being very stringent about criteria. But if a person has OCD, then they also have generalized anxiety. So it's like a Venn diagram where there's overlap and every patient has different set of symptoms. Of course, all of these conditions, like all of psychiatric conditions, are syndromal, meaning that even two people that have OCD or two people that have social anxiety don't necessarily have the same etiology for those conditions or the same pathophysiology, except in very general terms to say that serotonin isn't flowing, isn't functioning properly, and usually not due to a deficiency, but due to some functional incapacity that we just haven't discovered yet. Individuals that have these syndromes, their anxiety is endogenous, meaning biological. It is a part of their constitution. They were born that way. It's largely genetic because it is among all of the mental health disorders, it has the strongest correlation to family history that I've seen of any of the disorders, probably followed by bipolar disorder. When a person has that type of anxiety, there's always a first-degree relative, usually mom or dad, that has the same condition, the same tendencies to catastrophize, to worry, to imagine the worst-case scenario, to dwell, to feel overwhelmed and dysphoric, and to engage in avoidant and or compulsive behavior, to experience obsessive thought patterns, intrusive thoughts, and to be painfully shy with people, any or all of the above. Because family history is so strong, I believe it's almost always a genetic illness. It's in the chromosomes. When people are born with psychiatric illness or born destined to express illness when they reach the critical age, in the case of endogenous anxiety, there's almost always a family history